TSINY mourns the passing of the chairman of our fund development arm, Joel Mealy. Joel Mealy, community champion, engineer, and chairman of TSI Cares, passed away on May 6, 2013. Joel was an invigorating force who understood the field of mental health and worked vigorously to educate the communities we serve and to provide funding for innovative programming to allow the mentally ill to obtain their goals, said CEO Dr. Larry Grubler. TSINY planned to give Joel its coveted Lifetime Achievement Award and will bestow the honor on his family at TSINY's annual gala on October 17, 2013. Born May 28, 1934, Joel served our community in so many ways. He was a consulting engineer and professional planner. Over the years, he served as commissioner on the following boards: New York City Board of Standards and Appeals, New York City Department of Environmental Protection, New York City Department of Buildings, and Commissioner, New York City Coastal Commission. Among many other boards and organizations, he served as trustee, Queens Library, President, Board of Visitors, Creedmoor State Hospital, Chairman of the Board of Queens Public Television, Chairman of the Board, Peninsula Hospital Center, and Executive Vice President, Queens Council, Boy Scouts of America. He was a U.S. Navy veteran, serving 3 years of active duty and 29 years of inactive duty, retiring with the rank of captain in the Reserve of the Corps. He leaves his wife, Josephine, a son, Joel Jr., and 2 daughters, Vita Marie Chu and Janet Ann Mealy Powers, and 7 grandchildren. And he leaves us at TSINY with the memory of a man so dedicated to help individuals with mental illness. We were honored to have the opportunity to work with Joel Mealy, Sr. May he rest in peace.
Hello, my name is Judy Lev. I'm a Senior Vice President of Wealth Management at Morgan Stanley and a Senior Partner of the Lev Group. We help individuals and businesses achieve their goals through estate and retirement planning, lending, and wealth management. I have an MBA in finance, and I have made this my life career for more than 30 years. However, I started my career as an art teacher and earned a master's in art education. As such, I am firmly committed to the education and empowerment of people. TSINY's Education and Training Resource Center is a mental health project dedicated to assisting recovering adults in achieving educational goals, something I firmly support. I have been blessed with a wonderful, healthy family of 2 sons, 2 fabulous daughter-in-laws, and 5 beautiful and healthy grandchildren. I raised my 2 sons alone as a young divorced mother. Fortunately, I had a supportive family who stood by me and encouraged me through this difficult time. I realize many struggling people do not have support, and that's where TSINY comes in. I am a strong supporter and advocate of this organization because of their broad range of programs designed to help those struggling with mental illness become as independent as possible. For example, TSINY offers a wide variety of housing situations, ranging from short-term stay, supervised community resident programs, to extended stay, supported housing. TSINY's vocational program reflects a commitment to the belief that recipients can be successful in job situations with proper training and support, as do I. I wish to add a special thank you to our men and women in uniform who heroically serve our country. And I am grateful to TSINY for honoring us at this event. Thank you.
Hello, my name is Glenn Martin, and I have a variety of different jobs in my life. First and foremost, I'm a psychiatrist, and I've had a practice in Forest Hills since I left my residency in 1986. But I also have day jobs that I should mention. I'm an associate dean for research at the Icahn School of Medicine at Mount Sinai, where I help take care of human subject protection and do some resident supervision in the Department of Psychiatry. And I am also the Director of Medical Informatics at the Queens Health Network from the Health and Hospital Corporation, which means Queens Hospital and Elmhurst Hospital in the borough. I've heard about transitional services basically forever. I'm a Bayside boy, and I did my residency training at Hillside Hospital, and then went and my first job was at Queens Hospital Center running the psychiatric emergency room. And when you run a psychiatric emergency room, you are very aware of who the service providers are, both because they are likely to be sending their patients and clients to you, and because you're going to be returning them to them, as well as referring patients from your own inpatient services to the services that are provided. So transitional services has always been on my map of providers in Queens and in New York City in general. And has just been part of the fabric of being a psychiatrist in the community. So supporting TSINY is an easy thing to do. They have been providing crucial services to patients, clients, and families that live in our community since the mid-70s, and have been doing a wonderful job of that. It's obvious to everyone in the field that community-based services is where the focus of intervention has to be. It's vitally important to have hospitals and emergency rooms during acute phases of illness, but it's also important that patients have the necessary support, safe living environment, and outpatient services to allow them to succeed in that environment, to minimize their symptoms, and hopefully to achieve what their goals are, which are pretty much what everyone's goals are: to be happy, for many to raise a family, or to at least be in a good, stable relationship, and also to have jobs and, to the extent possible, to live independently. This is absolutely key for our patient population, and it is TSINY is a key component in the mosaic of providers that help our patients do the best they can. As is always the case, it's particularly meaningful when your efforts to the community and the patients and the clients that you serve is recognized by your fellow practitioners and those who are in the field working side by side with you. To that extent, this is a particularly meaningful honor to me because it comes from people that I've worked with and an organization that I have a great deal of respect for, and other people in this room and on your board who I know personally and know me, and it has both a personal and professional meaning that I'm really touched by, and I'm very appreciative for it. I do want to just make mention that the theme of tonight's affair is a reference to our veterans and men and women in uniform, and obviously I am particularly thankful to them. I'm also pleased that as president of the New York State Psychiatric Association that we have had the opportunity to partner since 2009 with the Social Workers of New York and the Medical Society of the State of New York to provide training to our colleagues in the field in recognizing and treating our servicemen who have come back from overseas with traumatic brain injuries and post-traumatic stress disorder. And in fact, we're just about to launch a new campaign to help educate our primary care providers, where we have found the bulk of our servicemen get their care from when they do return. And my understanding is there's 85,000 of our fellow New Yorkers who have served overseas in the last years in Afghanistan, Iraq, etc. And it's a real honor that we're able to provide that service to them. And it's, I think, very appropriate that we have an opportunity to honor them tonight. And lastly, I would just like to thank again TSINY for taking the time to honor our servicemen and to recognize me and my organizations for the work they've done over the years. I am very grateful, and thank you.